Is AI starting to replace doctors? Currently, AI in healthcare is everywhere. We're seeing it affect how doctors treat patients, how patients respond to doctors. But are doctors losing their skills because of artificial intelligence? I believe there are reasons why we can determine how doctors can better use AI so they don't risk de-skilling and not being effective in their jobs. Matter of fact, I'm going to go into 3 reasons what doctors can do today to avoid this coming de-skilling process. AI tools are moving in every direction, right? In healthcare. I mean, we're seeing it assist radiologists, processing insurance claims, even communicating on behalf of overworked doctors and other healthcare professionals. This is amazing, right? We're seeing discoveries of new cancer therapies and antibiotics while advancing precision medicine so we can help providers tailor specific treatments for patients that suffer from all kinds of ailments. But you know what? I think there are problems. Right now, we have just recently seen several things go haywire with AI. Recently, there was an article about Google healthcare AI made up a body part and doctors didn't even notice. There's a new study that also suggested that having a specialized AI tool taken away from certain clinicians that make them less effective in their jobs of delivering colonoscopies. That's right. Doctors are sometimes getting worse in their skills. And we're not just seeing this with healthcare professionals. We're seeing this with individuals in every industry, right? We're even seeing this with students. There's a study, MIT study, that talked about this, that said most people are becoming less effective at how to utilize technology and understand to remember things later when it comes to tests because they use AI so much. And so we have to guard against that. So how do we do that? Well, I do believe that perhaps doctors are trusting AI too much. One of the things that we also saw that Epic, which is the large healthcare company, they do electronic medical records. They're pretty much the 800-pound gorilla in our industry. They released news that they would have over 200, let me say that again, over 200 AI features in their next release. One such release was Epic Cosmos, a data set with medical events from de-identified longitudinal health records for 16.3 billion encounters, over 300 million unique patient records from 310 health systems. That's a lot of data, but are technology vendors partnering with health systems to replace doctors with systems like this, with all this data? Also in the news, we're seeing the rise of AI psychosis in patients as more and more patients are seeking mental health advice from ChatGPT and other AI chatbots. Often due to lack of access to mental health, which I talked in a previous video. We saw recently a young child decide to move on from this life due to conversations it was having with ChatGPT. This is a serious issue. I wonder, are mental health professionals have the skills they need to handle this coming crisis? I believe that we can all weather this, especially the healthcare professionals that do the day in, day out work of speaking to patients. But you need to follow a 3-step process to prepare for it. I want to ask you a question. Are you ready to understand how your skills can stay relevant even in the midst of more and more AI being used in your current workflow? Let's talk about the first point, which is go back to your training. What does that mean exactly? You have to understand going back to your training is so key. And that's going to be the element of what it means to be a great provider. Second, you have to question how useful any new tool is to your workflow. Bring back those critical thinking skills. And third, you have to move now, right? If you don't upskill today, you're going to be left behind. Well, my name is Theo Harvey. I'm a serial entrepreneur who went from lowly employee to a CEO who runs a remote multi-million-dollar healthcare startup from his home, raised $1 million from VC and investors, worked with large organizations like Cisco Systems, AT&T, Charles Barkley Organization, Blue Cross Blue Shield, and Google. My mission is to help healthcare professionals prepare for a new normal in healthcare before it's too late. The first point I talked about was go back to your training. Healthcare professionals got into healthcare because you have a passion for helping people, and that passion has led you to amass a ton of knowledge and skills to help them. You have to realize that that desire is innate and it's driving you to where you are now. No one goes to decades of school on the other end to have massive amount of debt to work 15-hour day shifts. That is not normal. So you have that passion. So go back to that. Please don't let that desire be taken from you, even in the midst of this deluge of new AI technologies. Continue to learn these new AI tools, right, to help patients, but don't rely on them solely. A quote from Dr. Regina Benjamin, former U.S. Surgeon General, said, Healthcare is challenging, but remember, you are the advocate. Never give away the power of your voice for patients. AI companies are pushing more and more tools, but ultimately, you really can't let that change your core identity of continuing to upskill with knowledge driven by passion. Start to adopt these tools quicker before they're forced upon you. Be forced to use them without even thinking through them thoroughly. That's so key. But we're seeing this change. There was a recent study that said 2/3 of physicians used AI in 2024, 78% jump from last year. So we're definitely seeing more physicians taking it to heart, even if it's as simple as doing a summary of the latest medical literature so you can provide the most up-to-date information to your patients. That is a start. I always think about this story. One of my favorite movies, Black Panther, right? If you haven't seen it, it's a great movie, but it's a pivotal scene where the king-to-be, T'Challa, is in a fight with M'Baka, his adversary, for the right to be the king of Wakanda. He's in the middle of this fight and it's not going well. He is getting his butt beat because M'Baka's stronger, he's a little bit faster. So T'Challa doesn't have his normal powers. He has to figure out how he's going to do this. In the midst of his lowest period, he looks up and his mother, the queen, tells him, "Show them who you are." And in that moment, he gets the energy and strength and he fights back and he beats back M'Baka. And in the middle of that, he repeats the refrain about his training, who he is, who he learned from, and all that. And I think that was important for him to rise up and become the king that he knew in his heart he was always. So what does that mean for you? The point of this whole story is that in the middle of overwhelm, don't forget why you became a healthcare professional. Let me say that again. In the middle of overwhelm, never forget why you became a healthcare professional, because you're going to see more and more technology, more and more tools. Obviously, you're dealing with the day-to-day patient care. You're dealing with administrative changes. But ultimately, don't forget that passion, because that's going to drive you to stay relevant. So what can you do? Just make a commitment. Just tell yourself that you will make a commitment to upskill, and so that you won't be left behind. Let's talk about secondly. You need to question how useful this tool is to even do your work. Bring your critical skills in to these new technologies. It's so important because you need to understand how it's going to really work in your workflow more effectively. For example, AI ambient listening tools are wonderful, right? They have proven to improve clinical outcomes. For instance, healthcare providers saw up to a 70% reduction in after-hours documentation. No more doing all this documentation at the office, not seeing your kids until after in bed. AI Ambient can help with that. Other studies have found significant improvements in quality and completeness of clinical notes generated by ambient listening tools, with up to 90% of draft notes accepted by clinicians, which is great. But it's equally important that you start to learn these new tools, but really understand where they fall down so you just don't rely on them. I have a story. I just recently talked to a primary care physician who is super excited, right, about using these ambient listening tools, because to her, it was about having that connection with the patient, right? A lot of times when you're coming to the exam room, you're seeing the patient, you're looking down because you're charting while you're talking to them so you don't forget your notes. So later on, you can put together clinical workflow, right, of how you're going to treat the patient. But what she found was with the listening tool, she can have eye contact. So now she's not looking down. And you saw that before where you had MAs come in and kind of chart everything while the doctor is speaking. Well, this is very similar. It's just an ambient listening tool that's taking notes while you're talking, which is wonderful. Now the patient feels more connected. Ultimately, a person feels listened and heard. They're going to speak more and you get more information to help them. But what she found was that sometimes the patient may reveal things that was a little bit private and didn't want the notes to just sit there. So she would go back at the end and look at those notes and determine which ones were not effective or too private, and so remove them. So you can't just rely on AI just to take the notes and submit them as is. You need that person in the middle, your expertise as a clinician, your judgment as a human being, take that information out so you protect that patient's privacy. And I think that's really important so that you can remain relevant in this new age of AI. What does this mean for you now? Well, I have one simple action plan. Take a course, understand technology, but more important, how technology can help you skill up, how it can help you grow your medical practice. In fact, we're offering a free masterclass. If you're interested, you can sign in below. And really it's just about getting around other individuals, see that excitement, understanding the technology and the tools and how it can affect you and make you a better provider, but more importantly, understand the importance of using them and thinking critically about how to use them more effectively in your practice. So if you're interested in that, click the link below, go join our free masterclass. It fills up pretty quickly, but please just put your information in and we can follow up with you later. Finally, we'll talk a little bit about why you need to upskill today, because you don't want to be left behind. Look, speed is necessity now, right? If you don't upskill, you're just going to be left behind. I mean, we've seen this time and time again, but more so now because you're seeing all these different tools and technologies being placed. Human beings still have to be that stopgap measure to ensure that the right information is getting sent and looked at and having the right judgment, especially when it comes to patient care. So you have to upskill now to learn the tools, but also bring your judgment to it. Stephen Klasko, former CEO of Jefferson Health, said, "Healthcare doesn't have the luxury of waiting for the perfect plan. Acting now saves lives. Hesitation costs them. Save lives." You have to go and move in that direction now. Don't hesitate. Don't wait. Not know you're tired, but this is the time to act today. So simple action, do it now. As soon as you finish this video, go watch the next video where we talk about other areas of healthcare and AI, or go take a course. But commit to doing something today and commit to doing it every day so that you can be prepared for the coming transactions. So in conclusion, we talked about going back to your training, understanding who you are at your core, the passion and knowledge that you bring to help people. Keep that even with the coming technology. Second, talk about understanding and bringing critical thinking skills to understand how useful these AI tools are to your work, and then understanding how they can be incorporated better so you just don't rely on it and have your skills deleted, or more importantly, not seen as relevant. And then finally, you have to do it today because things are moving extremely fast. Again, I gave examples of EHR records, sending information in, getting lots of data. You have to show that your judgment is more important than just data, right? Your gut feel of understanding human nature can be more relevant. So understanding what these tools do and upskilling today will help you prepare for tomorrow. So if you like these videos, continue to watch the next one as we talk into other areas of healthcare and AI.